Hey everyone, and welcome. Today we are going to be demystifying Parkinson's disease. We're going to dive into everything from the very first steps of a diagnosis all the way to the realities of long-term care. Think of this as a clear and comprehensive guide for this journey.
So, here's our roadmap. First, we'll untangle the often confused terms Parkinson's and Parkinsonism. Then, we'll walk through some key early signs you should know about. After that, we'll look at how diet can actually play a huge role in managing symptoms, explore an advanced treatment called deep brain stimulation, and we'll wrap it all up with some really practical advice for compassionate care.
All right, first things first, let's tackle something that causes a lot of confusion. You've probably heard both Parkinson's and Parkinsonism, but guess what? They're not the same thing. And getting this distinction right is absolutely the first, most crucial step towards a clear diagnosis. I want you to think of Parkinsonism as a big umbrella. It's the broad, catch-all term for any condition that causes that specific mix of motor symptoms, tremors, slow movement, and rigidity. Now, under that umbrella, Parkinson's disease is just the most common and well-known type, making up about 80% of all cases.
This table here really lays it all out beautifully. You see, with Parkinson's disease, it often kicks off with a tremor when you're resting, and it usually responds really well to the medication levodopa. But these other atypical Parkinsonisms, they show up differently. Take multiple system atrophy, or MSA. That one brings on severe problems with the body's automatic functions, like blood pressure. Or progressive supranuclear palsy, PSP, which can start with vision issues and a tendency to fall backward. These distinct differences are exactly what help doctors figure out what's really going on.
So now that we've cleared that up, let's move on to the question I'm sure is on a lot of people's minds. What are the earliest signs? It's so important to know what to look for, but it's just as important to understand what's just a normal part of life.
Okay, sign number one. This is the one everybody knows, a tremor, but it's a very specific kind of shaking that we're talking about here.
A tremor that might be a sign of Parkinson's is a slight shake that happens when your body is totally at rest. Did you catch that? The key phrase is at rest. It's totally different from the kind of shaking you get after a really tough workout or when you're super stressed or maybe from a medication you're taking.
All right, on to number two. This one might surprise you. It's a change in your handwriting, and it actually has a medical name, micrographia. So, what are we talking about here? It's when your handwriting suddenly seems to shrink. The letters get smaller, and the words look all crowded and bunched up. Of course, our writing can change for lots of reasons. Stiff fingers, getting older, maybe you need new glasses. But this specific pattern of smaller, cramped writing is something to pay attention to.
Another key early sign to be on the lookout for is a change in your posture. It's not just about slouching, it's a more consistent shift in how you hold yourself. So if your friends or family start saying, hey, you seem to be stooping a bit, or you just notice it yourself when you pass a mirror, that could be an early flag. Now, this isn't the same as hunching over because your back hurts from an injury. It's a more persistent, kind of unconscious change. And remember, with any of these signs, if you see a pattern, it's always a good idea to chat with your doctor. Okay, so we've talked about identifying signs, but what about taking action? Let's talk about something you can have some real control over, your diet. It can be an incredibly powerful tool for managing symptoms and just feeling better overall.
But first, and this is so important, a critical piece of advice from the Michael J. Fox Foundation. You need to treat your diet with the same seriousness as your medication. That means no major changes until you've talked it over with your doctor first. Seriously.
So what's the game plan? Honestly, the foundation of a good diet for Parkinson's is, well, it's a diet that's good for pretty much everyone. We're talking about a balanced plate, just jam-packed with antioxidant-rich fruits and veggies, lots of whole grains, and healthy fats. The whole idea is to give your body the best fuel possible so it can manage the disease.
Now, this is where diet gets really strategic, especially for people taking levodopa. See, here's the deal. Levodopa and protein basically fight for the same parking spot in your gut to get absorbed. So a really practical trick is to take your pill about 30 to 60 minutes away from any protein-heavy food. Some people even do what's called a protein redistribution diet, where they eat lighter on protein during the day and save their big protein meal for the evening. All right, let's shift gears completely and talk about a much more high-tech approach to treatment. This is where you can really see the incredible innovation that's happening, offering brand new ways to manage symptoms and, honestly, new reasons for hope.
So, deep brain stimulation, or DBS,
What is it? Well, it's a surgical option for when medications just aren't giving you that consistent control over movement anymore. It's a way to directly get in there and calm down the abnormal brain signals that are causing tremors and stiffness, helping to give back that sense of control over your own body.
And look, this isn't some brand new experimental thing. Just look at the history here. DBS was first approved way back in 1997 just for tremors. Since then, its use has just kept expanding to cover more symptoms and even earlier stages of the disease. The technology is just constantly getting better and better.
So you're probably wondering, how does this whole thing actually work? Well, it's basically a three-part system. You've got the neurostimulator, think of it like a pacemaker for your brain, which gets implanted near the collarbone. That little device sends electrical signals through these super thin wires, called leads, which are placed in very specific spots in the brain. And then you have a controller, kind of like a remote control, that lets the patient or the doctor adjust the system.
And for this last part of our journey today, we're going to talk about something that's just as important as any medication or surgery. We're focusing on the deeply human side of it all, providing support and care in the advanced stages of Parkinson's. This one is really for the families, the partners, the caregivers. Look, as the disease progresses, daily life definitely gets more complex. There's no doubt about it. But creating a safe, supportive, and calm environment can make an absolutely enormous difference in your loved one's quality of life, and in your own, too. So making the home safer becomes priority number one. And these are some really simple, practical things you can do right away. Get rid of tripping hazards like throw rugs. Install grab bars in the bathroom. Make sure every walkway is clear and bright. Tack down any loose cords. Little changes like these can seriously reduce the risk of falls.
And you know, communication might change too, but that connection, that is always possible. Using shorter, simpler sentences in a calm voice can really help. And sometimes you don't even need words. Just listening to their favorite music together, looking through old family photos, or even just sitting quietly outside can keep that vital bond strong.
And that really brings us to the big picture, doesn't it? We've talked about diagnosis and treatments and personal care, but if we take a step back, it really makes you ask, how can we, as a society, build communities that are more supportive and more understanding for everyone living with Parkinson's? Thank you so much for joining me today.